Welcome back to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers of Ruston, Jonesboro, and El Dorado, Arkansas. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hey.
So what are we talking about today?
Today we're going to talk about vertigo.
Vertigo, okay.
Yeah.
I've heard vertigo and I've heard dizziness. So is there do those go together? Is there a difference? Give me the scoop on that.
Yeah, they're completely different, and they get confused all the time. But vertigo is the simplest definition between the two. So vertigo is simply when your environment is spinning, okay? So if you lay down, roll over, sit up, stand up, whatever, and your room starts spinning, that is vertigo. Mm-hmm. Everything else is dizziness. Okay, so dizziness can be, like I said, a lot of different things. Dizziness can come from anxiety. It can come from, it can be like a lightheadedness, a nausea, just phobias, just a lot of different things. But vertigo is only your environment is spinning.
Okay.
Yeah, so, and the cause of vertigo, 97% of the time, is because of something called benign paroxysmal positional vertigo. And what that is where debris or rocks, crystals, Iconia, whatever you want to call them, inside your inner ear. Yeah, let's stick with crystals and rocks. Most people call them that. In your inner ear, you have 3 different canals, and that debris doesn't belong in those canals. Okay, so many times that debris will get in those canals, and it sends all kinds of crazy signals to your brain, and your eyes are trying to figure out what to do, and they're jumping around, and your room is spinning. Wow. And it is extremely terrifying. Remember, 13 years ago, whenever I was sick, right, I had vertigo. And whenever everything is spinning, you're completely out of control. Right. I've had lots of patients that, they're fearful, they think they're having a stroke or, something super serious is wrong. And it's really an easy fix, for a physical therapist that specializes in treating that kind of thing. So, again, vertigo is simply the room is spinning around, and dizziness is everything else. So if you have vertigo, you need to seek help from a certified vestibular rehab therapist, like here at Fyzical Ruston in Jonesboro and El Dorado, Arkansas. Here we have Johnny Pye. He is our new internal digital marketer, and he's going to help demonstrate some things. So if you have vertigo, you want to get in to see a physical therapist immediately, because the quicker we treat it, the easier it is to overcome, okay, and correct the problem. So, Johnny, you're going to stay setting up like this, okay? Scoot back that way. What I'm going to demonstrate is one quick test that we'd put you through, okay, to help determine what the cause is. So you're going to turn your head, tilt your head back, grab my arm, and we're going to go down real quick, okay? And you'll keep your eyes open, and I would watch for what your eyes do. And that will tell me where those rocks and the canals are in the wrong place, okay? Now, sometimes that's very easy to see as long as the eyes are open. Sometimes it's not so easy to see, and at that point, we use what we now have here at Fyzical, new innovative equipment that we use to help video that eye movement in case it's not so apparent. It's called infrared video goggles, and we're going to put Johnny back through the test here. Grab my arm, and we go down real quick. And then the goggles are going to be videoing what his eyes are doing, and I'll be watching that on camera, and I can go back and watch it again. Okay, so remember that BPPV is very treatable, and it can be treated immediately to help resolve your problems. So if vertigo is an issue, you need to call here at Fyzical Ruston. We are the regional headquarters for balance and vestibular issues. We can treat you immediately and help you overcome your problem. So just give us a call here at Ruston, 318-224-8994. All right, thank you guys, and we'll see you next time.